More than 65% of men over 50 will run into some prostate trouble. And what's the kicker? Most only realize something's wrong when it's already serious, like a marriage that's been crumbling for 20 years before you notice. And why? Because the prostate is sneaky. It doesn't scream for attention, but when it decides to act up, it knocks you flat. And to make it worse, many dudes are terrified of even touching the subject. Literally. Most prostate issues start quietly. No pain, no obvious warning signs. That's exactly what makes them dangerous. Guys brush off tiny changes as just getting older. But it's not. Your body does give signals, and the sooner you listen, the less it hurts. Watch for these signs. Trouble peeing. It takes forever to start. The stream is weak, and it feels like your bladder never fully empties. Frequent urination, especially at night, breaking your sleep multiple times. Burning or pain when peeing could mean inflammation or infection. Blood in urine or semen, a serious red flag that needs immediate attention. Pelvic discomfort, that nagging ache between your testicles and anus that just won't quit. Low libido or erection issues, not always just in your head. Your prostate could be the real problem. If you're in serious pain or absolutely can't pee at all, don't wait. That's a medical emergency, not aging. Head to the doctor. The prostate is small, but the trouble it causes can be huge, even deadly sometimes. Knowing the main conditions that mess with it is step one to actually taking care of yourself. Benign prostatic hyperplasia, BPH. The name sounds scary, but it's simple. Your prostate just gets bigger with age. It's not cancer, but it can mess with your quality of life. It squeezes the urethra, where pee flows, leading to weak stream, a perpetually half-full bladder, and constant bathroom runs. Treatments range from medication to surgery. Just don't ignore it. Prostatitis. This is inflammation of the prostate. It might be caused by infection or it might not. Either way, it hurts. Symptoms include painful peeing, fever, lower back discomfort, even pain during ejaculation. It can come on fast, acute, or drag on for ages, chronic. Treatment depends on the cause but usually includes antibiotics, anti-inflammatories, and doctor follow-up. Prostate cancer, the scariest of the bunch for good reason. It's the second most common cancer in men, after non-melanoma skin cancer. The real danger? Early prostate cancer often hides silently. By the time urinary changes, blood or bone pain show up, it's often already advanced. That's why screening isn't optional, it's vital. Early diagnosis means a much better chance to beat it. Treatment varies by stage, from surgery to radiation to hormonal therapy. Prostate health isn't just a matter of luck. Some men are simply born with a higher risk. Knowing where you stand can help you stay ahead of problems. Here are the main factors to watch. Age. After 50, your prostate starts acting like a classic car. It still runs but needs more upkeep. And as the years go by, the risk of cancer goes up. Family history. If your father, grandfather, or brother had prostate cancer, your chances are higher too. That's not a coincidence. It's genetics waving a red flag. Ethnicity. Black men are more likely to develop aggressive forms of prostate cancer. If that's you, start screenings earlier, around age 45. Lifestyle. Sitting too much, eating high-fat foods, smoking, or drinking heavily. That's basically an open invitation for prostate problems and a few other health issues you don't want. Hormones. Testosterone plays a big role in prostate growth. When your hormone levels are out of balance, problems can develop faster, so keep an eye on that. You can't just sit around waiting for symptoms to show up. By then, the problem might already be serious. Prevention starts with exams that can spot trouble early. One of the most common is the PSA test. The name sounds technical, but the process is simple. It's just a blood test that measures a protein produced by your prostate. Everyone has some PSA in their blood. That's perfectly normal. The concern is when the levels are unusually high, which can signal inflammation, benign growth, or even cancer. That said, a high PSA alone doesn't mean you have cancer, but it is a warning sign doctors take seriously. Another important check is the digital rectal exam, the one most men fear or avoid. In reality, it only takes a few seconds, isn't painful, and allows the doctor to feel the size and texture of the prostate. This can reveal problems the PSA test might miss. In some cases, your doctor may also order an ultrasound, done either through the abdomen or rectally, to get a clearer look at the gland. And if there's a strong suspicion of cancer, the next step is usually a biopsy, where a small tissue sample is taken from the prostate and examined in a lab to confirm or rule out the disease. Saying "I go to the doctor once a year" doesn't count for much if you ignore your daily habits, because what you do every day has a much bigger impact on your prostate than a single annual checkup. Start with your diet. Eating well doesn't have to be expensive. Fill your plate with real food, vegetables, fruits, whole grains, and seeds like tomatoes, broccoli, kale, and pumpkin seeds, while cutting back on junk food, processed meats, and ultra-processed snacks. Adding omega-3 rich fish like salmon or sardines is also a smart move, since they help fight inflammation. Movement is another key factor. A sedentary lifestyle is slow poison for your health, so aim for at least 30 minutes of activity each day, whether that's walking, cycling, lifting weights, or anything else that gets your body moving. This not only improves circulation and hormone balance, but also supports sexual health. Keeping your weight in check is just as important. Excess belly fat increases the risk of aggressive prostate cancer, and you don't need to be an athlete. Just avoid obesity. And don't forget to cut back on alcohol and quit smoking. Both habits increase inflammation, damage circulation, and weaken your body's defenses. Reducing or eliminating them will make a difference. Above all, listen to your body. Changes in your urine, libido, or any persistent pain are not things to ignore. The earlier you address them, the easier they are to treat. The prostate may be small, but when it acts up, it can cause big problems. The good news is that with prevention and the right information, you can avoid a lot of drama and keep living without turning every trip to the bathroom into a soap opera. If you've watched this far, congratulations. You're already ahead of many people who think taking care of their health is just for old folks. Now it's time to take action. Book your checkups, take care of your habits, and stop treating this as something to deal with later. Remember, the real embarrassment is showing up too late, not taking care of yourself. And if you know a man who avoids the doctor like a cat avoids water, do him and yourself a favor. Share this video with him. Who knows? Maybe this time he'll listen. Enjoy the content. Then like this video, subscribe to the channel, and see you in the next one.